I want to thank you, Rose, so much for being with me today. You're in a very exciting area because a lot of dentists have thought about, can I bill any of this stuff to medical? And I would say probably not even 1% of the dentists have gone down the road that you have mastered for 26 years, which is medical billing. And so I want to just start off with the obvious. Why do you think 99? What percent of dentists would you say have never billed medical insurance?
I'd probably say 90%.
90%. So you think 10% have?
Possibly.
Possibly, but is that because you're adding specialists like oral surgeons and?
With the specialists, it's actually more.
Yeah. So
yeah.
Rose, I'm just going to start off with the deal. Tell my viewers who have never billed a single dollar to medical insurance, what are you talking about? How can I do this? What procedure are you talking about? And what if they use Dentrix or SoftDent or EagleSoft? How does this even work? And first of all, start off, how did you even get into this?
Well, actually, I started as a hygienist in Indiana and moved to Florida after that. And I worked for a busy TMD practice that was billing a lot of TMD to medical. And I kind of figured out how to bill it. And the dentist friends started calling me. And so I wrote a manual. I wrote the first medical billing manual in dentistry. And then created a software for medical billing too.
So you have your software now.
Yes,
How does a dentist get a sample of that? What is your website for that, Rose?
It's DentalWriter.com.
DentalWriter.com.
Yeah, dental, DentalWriter.
Now, I got to tell you the truth. Whenever I see people talking about DentalWriter.com, usually they're talking about billing out CBCTs. I think a lot of dentists think that that's specifically just a CBCT medical billing piece of software. But you're saying it's also for other things.
There is another software called DentalWriter for cone beam. But DentalWriter bills everything to medical. Anything that you're going to bill to medical from a dental office, DentalWriter will build that.
And that's your software?
That's ours, yeah.
And at dentalwriter.com?
And it's called DentalWriter because it writes reports of medical necessity.
Oh,
okay.
Yeah.
And it bills the medical. But the key for medical billing is documentation and those reports, those narrative reports of medical necessity. And so it does a nice job with that, yeah.
So dentistry, we just bill a code. We did a DO. But if you're an MD, you have to bill a diagnosis with the code.
That's right, yeah.
Is that the main difference and nuance? The medical insurance wants to know.
The main key to medical billing in dentistry is, any medical billing is having that diagnosis code. And in order to bill medical, you must have at least one diagnosis code, whether it be TMD or sleep apnea, or for the bone grafts, it could be bone atrophy.
Really? Bone grafting? Yeah. Wow. I just learned something new, and I haven't even been talking to you I've been talking to you for 3 minutes and 30 seconds, and I just learned something new. Bone grafting. So even implant. Yeah. So it's mostly TMD, bone grafting, CBCTs. What else? What else am I missing?
Accident cases, sedation, especially for kids, is mandatory now as part of the Affordable Care Act. Anything surgical can be billed to medical. Medications that you write prescriptions, that dentists write prescriptions for, will be covered by medical. So lots of different things.
So also for the Americans listening, I know we're with iTunes that whenever we do a podcast like this, someone downloads it from every single country on earth. But sorry to ask a USA specific question. In the states have Medicaid, but the country national has Medicare.
Right.
And would you call the Affordable Health Care Act, does that affect Medicaid and Medicare and private insurance? I mean, that affects everything, doesn't it?
It does. It affects everything. We haven't billed much Medicaid. Dentists haven't billed too much of that. Pediatric dentists do. But as far as Medicare, that's very common for dentists to bill that. The Affordable Care Act does apply to all private carriers, Medicare, Medicaid.
Has the Affordable Care Act, otherwise known as Obamacare, has that affected your business, your dental writer? Have you had to change software or anything because of that?
Not because of that. Now, next year, every ICD diagnosis code is changing. And so they're going to be, instead of numeric, they're going to be alphanumeric. And so will affect dental writer. It's changing on October 1st of 2015. And so dental writer's all set to change over to the new code set on that day.
Yeah, you demoed me the code. It was at I'm trying to think of the seminar it was in Scottsdale 5 or 10 years ago. I think it was an orthodontic seminar, wasn't it?
Oh, yes, it was.
Yeah, so
Rondeau.
yeah, with Dr. Brock-Rondeau. So why were you at an orthodontic course? Is that more for the TMD, the TMJ?
No, we do have an orthodontic report writer because we're all about documentation. And so you can use that for dental insurance as well. It also writes nice narratives and letters to the patient.
Okay, so
but a lot of when you're talking orthodontist, sometimes you talk, or not orthodontist, but orthodontic course. Sometimes TMD is covered there too, and so our TMD module is very popular.
Okay, Rose. So I'm probably there's probably going to be a couple thousand viewers out here who have never billed a medical code ever. So pitch me on why I should go to www.dentalwriter.com. And how is this a long, steep learning curve where I need to have an office manager that's really Albert Einstein's sister, or is this a short learning curve, or how can I see a demo of this? What is the chance I'm going to get reimbursed? I mean, some people have no problem, like chiropractors. A lot of them have no problem billing out 100 patients of medical insurance, even though they only may get paid by 5%.
That's correct.
Is that going to be my case, or I'm going to bill up for every 100 procedures, 5 will get covered? I mean, tell me what I'm looking at.
Yeah, it depends on the procedure. If you're talking about the sleep apnea appliances, you should be seeing 95% of those being paid by medical.
Really,
okay.
95%.
Yeah.
That's a
absolutely
good sleep apnea, and that's for the retainer.
That's for the oral appliance, yeah.
And what's the average fee of an oral appliance? About $695? Or what would
$695?
Yeah.
No, the average fee is around $2,500 to $3,500, maybe $1,800. Anywhere from $1,800 to about $3,500 or so.
Okay, I'm going to go home and raise my fee today on that one. So 95% coverage on an $1,800 to $2,500 oral sleep appliance. Is that including the them taking home the sleep, the home study?
Well, medical will pay for the exam, and let's say you do a Panorex as well. Medical will pay for that, for the sleep apnea. And so you probably would include the home sleep test in that exam code.
Okay.
Some dentists bill the home sleep test to medical, but some just included in that exam code.
Okay, so then what would be another procedure? TMD? Are you talking about an oral appliance, a flat plane acrylic appliance?
Sure. If the patient comes in with pain, not just bruxism, but has TMJ pain or signs of TMD symptoms, then that can be billed to medical. That should be probably about, I have practices that get 80 or 90% of the insurances to bill or to pay for that.
And what kind of fee?
It's a little lower for the TMD appliances.
Right.
We've seen anywhere from $1,000 to about $2,000 for
wow.
TMD.
I must have the lowest fees in the country.
Yeah.
And then anything else? Anything else being billed in TMD?
The exam and the X-ray and the follow-up appointments.
Really?
Yeah. In some areas, about maybe 50 or 60% of the medical might pay for TMD, and in other areas, you'll see better. But yeah. But most of the time, it should be billed to medical if it's for TMD.
Over dental.
Yes.
Yeah. And then what about and you also what about the fastest growing area in dentistry now is CBCTs. Talk about that.
Well, there are medical codes for that, and keep in mind, as we'd mentioned earlier, you do need a diagnosis code. So you'll have to select whatever the diagnosis code is. If patient came in and you took the cone beam and you see a cyst, you could bill under that, or TMD, or bone atrophy, all kinds of different things. But your key is to have a diagnosis.
What about pericornitis from wisdom teeth?
It's possible that could be billed to medical.
Are a lot of oral surgeons billing CBCTs to medical insurance for wisdom teeth?
And a lot of general dentists are too.
Are they paying for the removal of the wisdom teeth too, or just
generally medical? Probably more than 50% of the time, the medical policies will pay for impacted wisdom teeth.
Wow. So
either completely or partially bony.
So there's 5,000 oral surgeons in the United States. What percent of them do you think bill medical?
Not as many as I thought. We work with general dentists. We don't have that many oral surgeons on board. Our market is general dentistry. But I am seeing that not as many oral surgeons bill medical as I originally thought. But they are billing for the cone beam, sure.
They are billing medical. So is your business starting to boom because of CBCT?
Oh, absolutely. Yeah.
Absolutely. Do you see that as a game changer?
Oh, absolutely. A few years ago, medical didn't understand why a dentist would have a CT scan in the office, and so they weren't paying very well. They're starting to pay a lot better for that now, so that's definitely.
And what is the fee? What is the fee usually for a scan?
Usually, the insurance will pay anywhere from $400 to $800.
$400 to $800 for a CBCT scan.
Mm-hmm.
And what
the average fee is around $4.
Mm-hmm. And go through the indications for it again.
Well, again, I mean, whatever diagnosis the patient comes in with, or what you see on the CT, you've got to have a diagnosis code. Mm-hmm. Whether it be abscess or cellulitis, or could be a cyst, like a bone cyst, could be a good medical necessity.
And you were also talking about medical billing for sedation. Mm-hmm. And then you said especially for kids. So talk about that.
Well, prior to the Affordable Care Act, it was hard to get sedation paid for because the insurance would be, well, we don't see why the patient needed sedation during that procedure. The Affordable Care Act mandates in every state that sedation be covered for kids. So that's really been a game changer.
Specifically for kids in dentistry? Or just kids for any procedures?
Dentistry.
Yeah, I raised 4 boys, so we literally lived in an emergency room, and I was always amazed at how a dental office is so more sensitive with nitrous oxide and topical anesthetic and trying to be pain free when the emergency rooms didn't even make an attempt. I mean, they didn't have nitrous. They didn't even try not to be traumatic. I mean, so it was a totally different atmosphere. So
they just go in and do whatever.
Oh yeah, and then you said bone grafting around implants. That was totally news to me.
Yeah, medical's more likely to pay for the bone graft than the implants, although I've seen them paid if the patient's medically compromised. Let's say a patient has severe bone atrophy of the maxilla or the mandible. That would be a reason that they pay, but only if the patient has difficulty masticating, chronic mouth sores, something that shows medical necessity. Mm-hmm.
So what would you?
Medical necessity.
So walk me through. I'm in office. We've never done this before. This is the first time hearing about it. I'm listening to you now. How would I get started in something like this? How does someone get trained? How is this going to work? And how hard is this going to be for my front desk and my insurance, my front desk staff to do this?
Well, there is a learning curve to medical billing because of the diagnostic codes. And what practices don't realize is that it's all about your documentation. So you would have to have the right narratives for each patient. It can't be like just one template letter you send in for every patient. And so DentalWriter helps because it has a questionnaire, let's say for sleep apnea or TMD or oral surgery. There's a specific questionnaire, specific exam form. You plug in the findings and it generates your report of medical necessity, if the treatment is in fact medically necessary. Then when you say the diagnosis, chair side, and the plan, it's going to link the the procedure and the diagnosis codes to the medical claim form, and put those in your narrative. So, a big part of what we do is record keeping and documentation. And I can't stress enough, if you're going to bill medical, you want to have that documentation. You don't want the insurance coming back and saying, we changed our mind. And if you have really good documentation of medical necessity, that's going to help a lot. It'll help you get reimbursed. But if the insurance were to come back and say, we want to look at this, you've got yourself covered.
So this is something you recommend the doctor using the software to put in the
team would use it. The way it works is the patient can actually fill out the questionnaire online, and then their symptoms and medical history will download into DentalWriter. And while the dentist is doing his or her exam, the assistant could be plugging in the exam findings chairside.
And then
when you get up and walk out of the room, you've got your narrative report and your medical claim all generated. So.
And then is this electronic claims, or is this something you have to print out?
You can print it or do electronic claims.
Through DentalWriter?
Mm-hmm. Yeah.
And what percent would you say are going through electronic claims versus printing out and doing the U.S. mail?
I think more of our practices use paper than probably electronic.
Really?
Yeah, probably, yeah. But we more and more are getting up on electronic.
Yeah. I would think you would definitely want to do electronic.
Yeah, that's what we recommend.
So, what would you recommend that the first step do? Do you have a demo at dentalwriter.com that shows all this?
We do. We have a short demo, and then what we do is we set up a live demo with the doctor where we can show the practice administrator, and we can show the practice then what it's all about.
So how do I go about getting a demo?
Just go to dentalwriter.com. and request a demo. There's a place to request a demo.
And would they actually get you, or would they get one of your?
Sometimes.
Sometimes they even get you.
Sometimes they get me.
It's got to be their lucky day.
Yeah. Thank you.
So what else do you want to educate them for someone who's never done this? They're saying, "Oh, come on, Rose, I'm busy. I'm overwhelmed. Really, pitch me more on why they should be doing this."
Well, I think it helps with case acceptance. You're going to have more patients be able to accept the treatment, whether it be implants or bone grafting or any type of oral surgery or sleep apnea or TMD. People are very insurance conscious right now. And if the medical pays, it's also going to save their dental benefits for dental procedures. So.
Yeah, and I got an MBA from Arizona State University, and the one thing they teach in economics is price is the most variable. It's the biggest variable. And if it's not price, it's installment. Like, do you know why Singer is the biggest brand name in sewing machines?
No.
Because there was a ton of sewing machines out there, but it was old man Singer who realized all these waves of Irish immigrants. I'm like 100% Irish at 4 grandparents and 8 grandparents. I'm still all Irish. And they were coming over by the boatloads, and he realized that everybody was selling a sewing machine, but if he sold it on installment credit for $1 a week, they could get a job for $3 a week. And so he was the only one that offered installment credit. And so Singer just took over the whole market.
Wow,
Same thing. Everybody will tell you about Henry Ford's Model T. But you say, well, whatever happened to that Model T? Well, it got crushed by General Motors because General Motors they did 2 things. They, instead of just the Model T, they offered 5 price points, Chevy, Pontiac, Olds, Buick, Cadillac, but they offered installment credit. Henry wanted his $668 right now, and GM said installment credit. So when a dental office offers credit, like care credit, then they're putting out more disease because more patients use installment credit. And if we can get a third-party health insurance or dental insurance to help pay for that, you're actually going to be a better dentist if you can get your customers a lower price, third-party insurance, installment credit. You're going to fight more disease.
Absolutely. And some of the things that we're billing to medical, like the TMD, is life-changing. And, tooth replacement, of course, is too, and sleep apnea treatment. So if you can get more patients treated for that, you're really, being a great practice and helping your patients. And I think if the patient knows their medical is going to help out at least with something, although sometimes they pay very well, then they're more likely to go through with the treatment.
And one thing I want to remind the dentists of is that a lot of dentists want a special niche market of like full mouth rehabs on the rich, or cosmetic dentistry, big cases on rich women or whatever. But I always think of when they accepted us in dental school, they were thinking of a public health dentist. I mean, they were thinking of someone that could treat a 2-year-old and a 102-year-old, and a rich man and a poor man and a middle class. And if you can afford to do a root canal, great. But if you need it extracted, great. I don't think a lot of these dentists would have got accepted to dental school if they told the dental school what they planned on doing with their degree. You know what I mean? And
Interesting.
I see it as we treat people. And we can't be judgmental, and we can't care where they come from, and anything we can do to help them be disease free is what we do.
Yeah,
so what else do you want to tell my viewers? What else do you want to talk to the office manager and the receptionist right now? What if I'm a receptionist and I said, I've been using SoftDent, EagleSoft, and Dentrix for 10 years. I know that system. How long is it going to take me to learn DentalWriter and what's the learning curve on something like that?
The learning curve on medical billing can take a long time, but it's going to go a lot faster with DentalWriter, because within a few hours of just looking at the questionnaires and exam and clicking in the findings from those, it's already going to tell you what diagnosis code and what procedure code to use. So I think, it would take a lot of research without it. Probably, we see practices get up and running within a few hours.
And what type of training do you offer? I mean, is there any online? First of all, how much is DentalWriter? Is it just one system, or is there different types of packages, or just?
It's a complete package with all the different modules, whether it be TMD, sleep apnea, oral surgery, all in one. It's $5,000 to get started with it, and there's the $99 a month is for the updates and support and the help center and training, and we've got great training. We've got a great team of technical people and great trainers as well. So there's all kinds of videos, quick videos, longer videos in the help center. We have a study club on Tuesdays where we have dentists who are guest speakers, and I would love to have you come on and be a guest speaker sometime too.
Anytime, be an honor.
And those are recorded, and they're all about medical billing for TMD, or how to treat sleep apnea, or how to treat TMD, and medical billing for all kinds of things. They're really good. There's 50 of those recorded study clubs now. We work with just the best dentists. I mean, we really love the group of dentists that we work with, and a lot of my mentors are doing study clubs for us now.
How long are these study clubs? How long is each one?
1 hour on Tuesdays.
And you have 50 recorded ones?
Yes, we do.
Wow, that's a huge library. Good.
Yeah.
So do you do them on Skype like we're doing, or that you do?
We actually do them on WebEx, but we might start doing them on Skype.
Yeah, Microsoft bought Skype for $8.9 billion. So hopefully, I don't know if they're doing good things with that or not. So if I give you $5,000, how long do you think it takes the average person who buys this for $5,000 to bill $5,000 worth of procedures that they get paid for and get their money back?
Oh, well, once they send their first case in. It'd probably just take them a few hours to get up and going. We actually walk the practices through the DentalWriter one-on-one. And so they have a couple hours of our time just to get started. And then they can watch the videos or call or get more trainings as well. So really, within a few hours, once you send the claim in, it's very much like dental. If you send your letter of medical necessity with the claim, it's going to be paid a lot faster.
But no, I was wondering how long does it take the average dentist to actually bill $5,000 worth of stuff?
Oh, well.
I mean, is that, a month, 3 months?
1 month.
So 1 month, they'd probably get their investment back.
I would think so. Yeah.
I mean, not many businesses can say invest $1 and you'll get it back in 30 days.
Yeah.
That's a
Yeah.
hell
It
of a
might be.
return.
Yeah. Yeah.
And how
Yeah.
much? Yeah, and
Is that most dentists aren't sending their TMD appliances to medical. And so if you do actual TMD, not like a suck down bruxism appliance, but TMD appliances, those should go to medical, lots of different things.
And I'm embarrassed to say this, Rose, but we have viewers from listeners, viewers on Dental Town YouTube or listeners on iTunes from literally from here to Equatorial Guinea and Kathmandu, Nepal. Is this only for U.S.?
Yes, it is.
So it's only U.S. So if you're like, it doesn't do Canada or Australia.
Well, actually, we have quite a few folks in Canada, practices in Canada using it because they like the report writer. The medical billing doesn't translate, but DentalWriter does nice narrative reports. And we have clients in Australia, in England, and Canada who use that part of the DentalWriter.
Okay, so they could use the narrative diagnostic part.
That's correct.
And then transfer that to their own country's health insurance.
Absolutely. And another good use of the narrative reports is to send them to the physicians that the patient has, and that gets the word out about the treatments that you're doing. And it's a great way to build relationships with physicians.
I think it's always amazing whenever I'm lecturing in China or Brazil, where the dentists just look confused, like, well, they just can't believe that anybody else would pay to fix your body, because they're like, well, if you drink Coca-Cola and don't brush and floss, you need a cavity, why would anybody else pay for this? And if you smoke cigarettes and don't exercise and drink whiskey, why is it the government? Or it's really it's kind of indefensible, because you don't really have a good answer. I mean, I'm responsible for my car, I'm responsible for my house, but when it comes to my body, I can abuse it all day long, and someone else is going to pay for it.
That's interesting. I've never thought of it that way.
Yeah, the Chinese don't get it the most. They're just like, well, they go, well, you're incentivizing bad behavior. If you're smoking, drinking, if you're not taking care of yourself, you should pay for it. You should learn your lesson. And
interesting.
Nobody. Only about 20 socialized medicine countries buy into this. Someone else should be paying for your routine chronic neglect diseases. So what else do you want to talk about? Have you covered it all, or is there anything else more you want to say? Well,
I think some of the office administrators are probably thinking, we had that accident case who came in, that patient who had an accident to teeth maybe 6 months ago. We give our seminars. They're like, how far can you bill back? Because we have this case we want to bill. Usually you can bill within a year. So if you think of any accidents to teeth, that should be billed to medical as well. Okay.
And it's amazing because our fellow chiropractors have mastered billing accidents. I mean, work injuries, car wrecks, and
yes.
So you're talking about you talking about just auto accident, or are you talking about
not just auto, just like if someone's on a ladder and they fall from a ladder and they're missing teeth or break teeth. There's codes for that. There's codes for missing teeth due to trauma, broken teeth, and then there's codes for fall from ladder, fall from on playground, all kinds of codes. Fall from animal.
and does insurance does it matter if you fell off a ladder at work versus at home?
Well, if it would be at work, it would be workers' compensation you would bill.
And are you seeing a lot of...
Sometimes at home it might be homeowners, but it could be the medical too. Yeah.
Are you seeing a lot of workers' comp claims? A lot of people use it for workers' comp?
We see that for TMD.
Mm-hmm. What about domestic violence? What about your husband knocks your front tooth out?
Well, that would generally be covered under the medical. Because
are there codes for domestic violence?
There are. Mm-hmm.
My last domestic violence case, front 4 teeth were knocked out, but what was bizarre, he punched her so hard in the chest, she had a split, and they had to put like 6 staples in. Could you imagine the force of a punch that just vertically split the skin above her sternum? I mean, just crazy. But medical insurance would be paying for domestic violence? And with the
General.
auto accident, would you be billing that to the auto insurance policy?
Right. Yeah. If it's a car accident, it would be auto.
And all of this is on your DentalWriter
Yeah.
and so also and you have phone operators for tutorial. If someone's stuck, at 9 o'clock on a Monday, they can call and talk to somebody.
Absolutely. We've got a great tech team.
That's amazing, right there in Jupiter. So
Yeah, right here in beautiful Jupiter, Florida. And we give seminars right here, too. We give them all over the country and some in Canada, but we give a lot of seminars right here in South Florida, in Jupiter, Florida, which you fly into the West Palm Beach Airport. Very nice area.
I've always wished you would put that course on Dental Town.
Yeah, I think I would love to do that, Howard.
Really? How long is the course? Is it an all-day course or a half-day course?
We have a half-day cross-coding course, which is medical billing for dentistry. We have a all-day one. So it could be any length of time that I would love to do that.
I wish you did because
maybe like a 3 or 4 hour course I think would be a good starter.
Well, this is what I tell people.
Or they usually an hour.
This is being a dentist 27 years and all my friends are dentists. What I tell them is this: dentists before dentists buy like talk about a consultant. They're never gonna give 30 grand to a consultant to find out what's behind mystery door number 3. And so the consultants that are the most transparent, they get on Dental Town, put on their courses, because the dentist might be thinking, well, I don't want to give you 30 grand and then you come in and say, drop all insurance and be a cosmetic dentist or something I don't want to do. So they see the consultants, and a lot of them are secretive and they don't tell you what they do or anything. And other ones are transparent. Then they say, oh, I like this person and I believe all that. And actually what they're paying for is just for you to come in and implement it. They're paying for accountability. They don't want any mystery. So for me, I think for you, the more courses you put on Dental Town that their front desk and office manager and the dentist can watch the whole thing and every question answered, then when they sit there and say, okay, I get it. Yeah, this would work. I'll do it. Then they'll give you $5 grand. But to give $5 grand and have all these wonderings, it's kind of like what they teach you in sales. I'll never forget. My dad made me go. One of his buddies at church had a car dealership, and when I was like 12, I had to go sit through a 3-day weekend training to sell cars. And like if somebody, I'll never forget this one example. He goes, somebody walked in there, and a young salesman. She said, she goes, I like this car because it has a moonroof. And he said, no, that's not a moonroof. That's a sunroof. And then she's like, oh my God, did I want a moonroof or a sunroof? So she turned around and left. And this guy's, and Mr. Donovan's saying, she wants a hole in the top of the car. Who cares if it's moon, sun? Why didn't you get in there and show it to her?
To get him confused.
And if she sat in there and liked the way it opened and closed, she would have bought the car. Yeah. And so that's the way I think dentist minds work. They want to see all the details, and once any little unanswered question, they're gonna have anxiety and not want to sign the dotted line. And once you've dotted every I, cross over T, and him and his office manager and his front desk and his assistant are saying, yeah, we should do that, and then you'll get the check in the mail.
Yeah, I agree. I'm like you. All my friends are dental people, dentists and dental team, and I think the more sharing you are and the more transparent and the more information you give out, the more trust there is. So definitely. Even when we do the demo of the DentalWriter, you'll learn something. You'll learn about medical billing and see some good codes to use and everything. So
all
definitely.
Right. Well,
I'd love to do a course on Dental Town.
Please, let's do it. Send me an email, howard@dentaltown.com. The guy in charge of that is Howard Goldstein. Do you know Howard Goldstein? He's in Bethlehem, Pennsylvania. We hired him several years ago. Once he hit 30,000 posts on Dental Town, we said, "Okay, come on, you're not seeing patients anyway. You could only be on Dental Town to have 30,000 posts." So we hired him full time, but he's in charge of the online CE courses. We got, and we would love to have that. Is there anything else you'd want to tell these people?
No, if anyone has any questions, they can contact me, and I'll be happy to answer any questions as well.
And how do they contact you, Rose?
They can go to DentalWriter.com. They can call the 800 number, which is 1-800-879-6468, and just ask for me.
And say the number one more time in case I didn't get it.
It's 1-800-879-6468.
And can they email you?
Oh, absolutely.
What's that?
It's Rose at DentalWriter.com.
And that's writer, WRITER.
TER, DentalWriter.
Well, Rose, thank you for writing the first manual in medical billing. That's a pioneer. I got to hand it to you. Anytime you're a first in anything, that's just an amazing. You must have an incredibly amazing mind, an incredibly amazing pioneer. Thank you for all the earthlings that you've helped get financing so that they can have a healthier body. That's got to make you feel incredibly proud.
It's rewarding.
And it's got to be incredibly rewarding to know that you help someone get financing so they can take care of their body. That's got to be incredibly rewarding. So thank you for all you've done for so many people. Thank you for what you've done for dentistry and Dentaltown. And I'm going to hold your feet to that fire and hope you and Howard Goldstein get some courses up on Dentaltown.
Okay, will do, Howard. Thank you so much.
Okay, and I hope to see you in Jupiter. Next time you're in Phoenix, call me up.
I will.
Okay, Rose. Have a good day.
All right, thank you.
Bye-bye.